Okay. Hi everybody. My name is Jane Barlow. I am a Professor of Public Health at Warwick University and lead of the Warwick Consortium. And what I want to do in the next half hour really is just share with you the outline of what it is we plan to do to evaluate whether what you're all doing on the ground makes a difference for families. And I know that that is going to be a mammoth task. We know that that is a mammoth task from some of the earlier evaluations that have been conducted, Head Start, Sure Start. And what it was incumbent upon us to do really was to stand on the shoulders of these people that have gone before and make sure that we have learned the lessons from these earlier evaluations and to make sure that we were in the best place possible to show that what you do on the ground is going to make a difference for these families' lives. So what we want to be doing in the next half an hour is just to introduce you to some members of the team and then to spend 5 or 10 minutes really just giving you a little bit of an outline of what it is we want to do over the next 11 years and how we're going to be doing it. We put together a 150-page protocol that poor Andrew and his colleagues had to wade through. We've managed to reduce that to 4 slides. You'll be grateful to hear. And what we're going to be doing is producing some user-friendly documents for everybody out there on the ground so that you can, bury yourself in a bit more detail and get your heads around what it is that we're going to be doing to evaluate this fantastic new way of working on the ground. So it was a momentous occasion really when Andrew came and told all of us that we were the preferred bidder, because we are all completely passionate, we're as passionate as you guys are about identifying what works and working with people on the ground to change outcomes for children. And it really isn't very often that you get an investment of 11 years to evaluate whether something makes a difference. So it is just a really very exciting opportunity. We were all as a team very excited. And I really just want you to take away from this 2 key messages. Even if you forget everything that's on the rest of these slides, we'll be able to share the detail with you. There's going to be lots of opportunities to do that over the coming months and years. But the 2 key messages that I want you to take away today are, firstly, that we are going to be working in partnership with you on the ground, just as you're going to be working in partnership with the families. And Andrew divulged in confidence to me over lunch, and I'm going to share it with you, that I used to scare him. I said, did I, Andrew? When did I scare you? He said, well, it's kind of just a bit scary having all these academics with all these qualifications. And I said, but then you spoke to me and you realised that I wasn't scary, didn't you? And he said, yeah. And so, really, we want you to know that we are there alongside you on the ground and working with you, and you really are, over the next months and years, as I say, going to have to begin to trust that you can talk to us and we will be coming and talking to you, and we need to share problems and we need to share concerns. So we really do need to be working together in partnership over the next 11 years. And the other message that I want you to take away from today is that you really do not need to be anxious about this 150-page evaluation that we're going to be putting in place over the next 11 years. I know that evaluations, I know that randomised control trials, I know that cohort studies make people on the ground feel very anxious. But you really do not need to. We will be working alongside you, closely with you, to ensure that this runs smoothly and to ensure that you are able to do the things that we're really going to need you to do in order to assess whether this makes a difference for families. So what we're going to do is us just spend a little bit of time telling you who we are and what it is we're going to be doing, and then we're going to just give you 5 minutes to just talk amongst yourselves, to have a think really what the key things are, what your concerns are at this point, having seen my reductive presentation of 4 slides, and then we're going to just have 10 minutes question and answer. So we really want you to have an opportunity to tell us what it is you want more information about, what you think of the evaluation and how it might work. So who are we? We are a squabble, apparently, although we haven't squabbled so far, have we? But we may fit 1 or 2 in over the next 11 years. We are a group of researchers, really, because we're not all located in academic context. You can see from this slide, we come from a number of universities. Warwick, Jeff and myself. Kathy comes from Oxford. We've got 2 researchers, God heaven knows, I refer to Vivek Glover as a researcher, from London, Imperial College and King's College. We've got Deborah Beck from King's College London. We've got a couple of academics from Durham and Glasgow. We've got researchers from Ipsos Mori. Of course, Ipsos Mori are a national survey company, and they've got a lot of expertise in collecting data on the ground. So their researchers are going to be working very, very closely with you on the ground in terms of actually getting the data from families. We're also going to be working with Bryce Purden Social Research, who are again got a lot of expertise in the conduct of this sort of longitudinal evaluation study. And of course, we've got people from the National Children's Bureau, and Emma Solomon here is our lead for that. So that is the team. And what is it that we're planning to do? Well, essentially, over the next 11 years, we need to find a way of showing that this intervention makes a difference in terms of the 3 sets of outcomes that we're interested in. So, as I say, it's going to be conducted, it's longitudinal, it's going to be conducted over 11 years. We're going to be focusing on things such as the setup, the implementation and the impact of this programme, both within and across different sites. And in addition to doing that, we're also going to be focusing on really sharing this learning. A big part of this contract for us was designing effective ways of disseminating the learning across the sites, and then even wider beyond that, so that we can ensure that the lessons from this massive investment really do get rolled out, not only nationally, but where appropriately internationally as well. And I know you tend to think of a randomised control trial when we talk about rigorous evaluations of what works, but obviously, we can't do a randomised control trial where we've got 5 sites already selected. So we have put in place 4 work streams, essentially. Work stream 1 is going to be focusing on what we're calling our implementation evaluation. And this is really going to be burying down very deep in terms of identifying what you guys are doing, how you're doing it, whether families like it, and whether it appears to be working on the ground. Work stream 2 is our impact and our economic evaluation of the area programmes. So when we say the area programmes, we're talking about the programmes that are implemented across the 3 to 5 sites that are eventually selected. And you can see we've talked about impact here. Work stream 3 is looking at effectiveness, and we distinguish between impact and effectiveness because we can only look at impact with this sort of study design. And you can see we've got some effectiveness evaluation, that's work stream 3, and then work stream 4 is the sharing, if you like, of the learning and the dissemination across the 3 to 5 sites. So let's just look in a little bit more depth at what each of those involves. So work stream 1 is our implementation evaluation. And what we've done is divide this into 2 phases. So phase one, we'll be doing something not dissimilar really to what Michael has been doing with you in terms of working alongside you to get things set up so that they're working really well. And in this phase, which is going to last for about 18 months, and will be at the very, very beginning of you guys changing what you're doing and implementing the new ways of working, we're going to be using what we call a participatory action research approach. And this really is essentially aimed at ensuring or optimising, if you like, the ways of working that you've all put in place on the ground. So what we're going to be doing is exploring in a little bit of depth. We'll be talking to practitioners, we'll be talking to the people that are receiving the services in the early days, we'll be collecting some preliminary data, and we will then be feeding that back to you guys on the ground so that you can, at this very early stage, make any changes that are necessary in order to really optimise the delivery of the service. Then we move into phase two, and at this point we start doing more formal implementation research in terms of measuring some of the, what we call the inputs. Those are the things that go into the service, the activities, the things that you're actually doing on the ground, and the outputs in terms of the collecting some of the quantitative and qualitative data. So Professor Jeff Lindsay is going to be leading on this strand of work. Jeff, do you want to just say a couple of words?
Just a couple. Given the time, just a few words. Really just to reinforce all that Jane said. Some of you may know that the work we did on the Parenting Early Intervention programme, which over about 5 years or more, we worked very well with up to about 60-odd local authorities. We are, as Jane said, very committed to this programme and also to working with you. So the work stream one is effectively looking at the processes. So we're interested in what you're doing, how you're doing it, how well they're working in the way that Jane just described. So I won't go on anymore because we've only got limited time.
Thanks, Jeff. Okay, so work stream two is what we're calling our impact and economic evaluation. And I'm really impressed that I managed to condense this into one slide. I'm not sure how valuable what the information is that I've got here, but essentially what we're going to be doing is tracking 2 cohorts in the intervention, the 3 to 5 areas. So we're going to track what we call an early cohort and a late cohort. And again, we've decided to do this because we feel that in many of these sites it's going to take quite a while to get these services embedded, to get staff up to speed, to get people working optimally. We know that if we measure outcomes at this point, we are in serious danger really of potentially showing no evidence of effectiveness. So we're then going to start following a late cohort that will be begun from year 4 or year 5, and that will give us the opportunity to track those families through to the child being 7 years of age. And you can see here what we're going to be collecting is individual data, by which we mean we're going to, and when I say we, this will be Ipsos Mori, will be delivering both interviews and postal questionnaires, a small number of postal questionnaires, to families that have received services in the 3 to 5 areas. And then we're also going to be collecting a lot of population level data. We'll be collecting data from some of the standardised data repositories that are out there. And you know, the focus is going to be on the 3 outcomes: nutrition, language, and socio-emotional development. And it's very exciting because we've really got a lovely, lovely opportunity to follow these families from pregnancy through to 7 years of age, and that is pretty unique. And Professor Kathy Silver from the University of Oxford is one of the leads of this work stream, so I'll just let her say a few words.
I think Jane has actually said most of what you need to know. No, the one thing that we haven't talked about are who are we going to compare these children to, because the children are developing and they're getting services in all local authorities, and so we have for each of the areas that will have be doing the experimental and the new work, we'll have 3 comparison authorities. So we'll be tracking children and their families in the comparison authorities. So we'll really, because they will also be getting services. We can't imagine a child and a family who gets nothing, because luckily we live in a country where this isn't the case. So the real challenge for us will be to track development of families and children who are getting services, but those children and families in your authorities are going to get a new kind of configuration of services, so we'll be able to compare. I think that's it. Thank you.
What would I be without you forgetting to mention the control sites? Fantastic. Yes, of course, we're going to have some closely matched control sites that aren't involved in the receipt of this wonderful funding. Okay, so work stream 3 is what we're calling our effectiveness evaluation, and we're really keen to build in a small number of randomised control trials, really to give us the opportunity to look at whether some of these innovative ways of working really can be regarded as effective, if you like, using one of the most rigorous methods we have of doing that. It's very, very difficult, of course, to build a randomised control trial into something like this, because we've got area-based services where all families are getting all services. So how do you then build an RCT on top of that? So what we're going to have to do, essentially, is to identify some of the services that are working with, possibly with families that have got additional needs. So, for example, I put here the circle of security. We know potentially that the circle of security is an effective way of working. There aren't yet any randomised control trials of its effectiveness in the UK, and we could essentially work with sites that are delivering programmes of this sort to small groups of families. We could essentially do some randomised control trials to look at their effectiveness. And of course, BIG being very egalitarian in terms of their ways of working, really wanted us not to randomise families to no services, and so they stress. Okay, so you can see here the use of a waitlist control group so that all families receive the service. Okay, so work stream 4 is our dissemination and learning module. This stream of work is being led by the NCB, and Emma, do you want to come and talk us through this slide?
Bearing in mind time is tight, there's just 3 key elements to what we're doing, and we've called each of them, given them each of them very clear titles. So the first one is about connecting for change. This is making sure that all the networks and connections are made not just across the sites but within the sites, because actually if we just assume that someone who's involved in a voluntary sector agency will automatically be able to engage with someone who's working in public health, as we know, it doesn't work like that. So there has to be proper connections within the sites as well as across the sites. And then we need to really make sure that knowledge is exchanged, that there is that shared learning embedded within the programme, and that we facilitate that learning and that knowledge exchange. And then the final one is about ensuring that there is a fundamental legacy, and that actually the learning and the dissemination from the work in the sites reaches right across to those decision makers who are going to be making very important decisions about resources in the present and in the future. And the whole of this strand is very much about doing it in co-production with the sites, because actually the learning and the dissemination has to be embedded in your work, and you have to feel that that is an integral part to what you're doing, and you have a valuable role to do that. So we will be doing it in a collaborative way with the sites, and we will be ensuring that that learning is disseminated effectively, and that the process fundamentally leads to some lasting impact, because that is what we all want to see from the project.
Okay. And we've just listed here some of the fantastic resources that the NCB are going to be providing you with over the course of the 11 years, and so this is very exciting, I think. And this is the timetable. So you can see here we've got our 4 programmes of work, 4 work streams, and they are going to be running side by side. So you can see we've got our phase 1 and phase 2 implementation that will run alongside our cohort study. You can see that we've got our 2 cohorts there. We've got the first cohort that will begin in 2015 alongside phase 2 of the implementation evaluation, and then you can see that the second arrow refers to our second cohort, our later group of starters once services have become very fully embedded. We're not completely clear where the RCTs are going to fit in timing wise, and essentially, you know, it's a movable feast really. It depends essentially on what sort of services are provided, but we would really like to start to do those fairly early on in the proceedings. And then of course the work stream for the learning and dissemination will go really, will start back in 2014 and go right through to the end and beyond. So that is all there is to it. So maybe you would like to take 3 to 4 minutes till 3:05, and then we will have some questions. So do you just want to talk to the people that are near to you to identify things that you would like to ask us about?
I've got a question. So when is this all going to start? And is there going to be any expectation for us to participate during the development phase of our bids? And secondly, yesterday there was a lot of talk about how the area is going to, even if you don't get the funding through the big lottery, we're going to put together partnerships and we're going to push forward with some of this work anyway. Will all of the areas be monitored, or will it just be the areas that receive funding?
So I'll start with your second question first. Only the areas that get funding will be taking part in the evaluation that I've just been describing to you. And in regard to your first question, which was when are we going to be starting the implementation evaluation, will start once the selection of the final 3 to 5 sites has taken place. So we'll be doing a bit of liaison work, I think, prior to that, but we won't actually be kicking off until the middle of next year, I think it is. March? April? Yeah. Is that okay to answer your question? Yeah?
Our question really was about the support that you might be putting in place for us to have systems and processes in order to collect the information that you're requiring. Is that something that
Yeah. Jeff, do you want to talk about that a little bit?
The link to that was really what training there is in order for everybody to really understand fully who's working on the programme and evaluation, so that they are able to deliver what it is that we require.
Understanding about who the team members that are working.
Yes, the team members, to understand the process of your evaluation so that they are able, with that understanding, ensure that they are able to provide you.
Yeah. The first part of our programme of work involves a quite extended period of liaison with the actual site. So the research team and members of the research team will be coming out, meeting all the people on the ground really, and just establishing the relationships and the partnerships and sharing with you all that you need to know really in terms of the evaluation and addressing all of your concerns. So in terms of the process data, Jeff, do you want to say something about that?
Yes, the other thing to bear in mind is over this first phase, Dartington will be working with you. So we are the evaluation team rather than a training team, if you like. So as Jane said, the focus of our support will be working with you about the systems that you're developing in terms of what you are deciding to develop, why you're deciding to develop it in a particular way. So that will be coming from your discussions with Dartington and internally, looking at the baseline, what the systems that you have at the moment, what are the services, how do you change from the services you have to the services that you're thinking of developing, the sort of policy decisions that have to be made within the local authority or the health service, etc. So it's not so much that we are helping you in the sense of training, but we are certainly going to help you in terms of understanding what the evaluation is and how it's working with Dartington. So one of the first things we'll be doing is actually meeting with Dartington so that we can start to plan some of those issues, which we can do before we actually know which sites have been selected. So that will be something that we'll be doing in this term up until Christmas.
Does that answer your question?
Yes.
Not, you don't sound sure?
It may be I've given you an answer which is not quite what you were hoping for, but...
No, it was more the process of evaluation, so like your cohorts or so. So it wasn't really about our model delivery or what we are going to be doing in order to improve our outcomes. It was more your process of evaluation, so that people really understood the evaluation methods that we use.
Yeah. So we will, as I say, we will...
And the systems we need in place to...
Yes. Yes. No, we're going to spend a lot of time. The first 6 months of our contract really is going to be working with you guys on the ground to ensure that, you know, everything that needs to be in place is in place, and to ensure that people understand what it is we're doing and why we're doing it and how we're doing it.
Do you expect the evaluation
Going to be helping you guys to collect data on the ground, and we've got in place a management information system that's going to pull it all together. Yeah? Shall I just take, is it okay just a quick, yeah, because there's lots of hands shooting up, I can feel, yeah.
I just wondered how this works with the monitoring systems that the Big Lottery have on their forms, which are fairly simple and basic, but we're expected to put in the form, the application form, what we're going to do. And how's that going to work? How's your evaluation going to work alongside that?
I'm not sure what it is in the forms, but can you actually, oh, sorry.
Thank you, that's a great question. Thank you for that. I'll take that. Yes, you will be required to do monitoring and reporting back to the Big Lottery funds. But what we're asking Warwick and the partners to do is a different order of evaluation about the outcomes over the long term of 11 years. And your reporting to us will be as normal, it will complement the stuff that works.
Okay.
If there is a tension and a gap, we will address it.